1 in 4 people in Britain will experience a mental health problem at one point in their life. But this is tackled by a law which dates back to 1983. It's considered outdated, but worse, unable to deal with new problems, such as Michael Stone, a dangerous psychopath. That man murdered Lynn and Megan Russell in 1996, but could not be held under mental health powers. The Mental Health Bill aims at saying no to another Stone case. It proposes to make it easier to detain people and force them to undertake treatment, whether or not they have committed a crime. That would affect about 14,000 of the 600,000 people who use mental health services each year. But the response is hostile from charities and medical professionals. They say the number of patients who may pose a danger is too small to justify the powers of detention and compulsory treatment.
I don't think it's wrong, but there's implications, of course, in the new legislation coming. I mean, what the government proposal to do is to use the existing mental health legislation and make some minor changes into this new proposed bill. The cost implication is the government would like I said early on, government would like other mental health professionals such as the community psychiatric nurses, the occupational therapist and the psychologists to be able to do those roles. In the past, and as it stands now, it is the approved social workers who are trained under local authority and in social care to be able to detain people with due recommendations. And also they're talking about not nurses, psychologists and OTs are going to have the powers, but there will be RMO, like I said, the responsible medical officer, who is the consultant psychiatrist, will share their skills with the nurses, the OTs and psychologists to be able to make important decisions of when to discharge people. So there will be cost implications and there will be an extended role. Do nurses want that? Do psychologists or OTs want that kind of role? I think that's the questions, and that I'm concerned that if the government is able to pay and is able to provide more, then it will still have a bit of a problem. But this needs to be discussed further and to look further.
However, the government says the bill strikes the right balance between patient safeguards and protecting the public. The Health Secretary, Patricia Howitt, says it is essential to ensure that discharged patients continue to take medication. She says modern medicine and clinical practice have shifted the whole focus of care into the community, and the law needs to follow. And after the different setbacks, the bill is now set to make it through Parliament.